We're there to help them, at the bedside, to help them, get through their pain. A victory for me is making a connection with a patient or even a family, relieve some of their stress and anxiety and have them start to trust you and help them, through their process. I consider that a victory, for me.
Just a thank you, I feel better, just thank you for being here for me. That makes it all worth it. I do feel like I'm making a difference, and I do feel like I'm doing what I should be doing. I mean, we work hard, we work really hard, but if you can make the patient smile and happy, then it's worth it.
Yeah, I know.
My mom is a breast cancer survivor for 10 years, and so she goes for frequent follow-ups. And one day, she was actually visiting me here in Connecticut. She lives out of state, and I said, "How was your day?" She said, "I had my mammogram," and I said, "It was fine." She said, "No, it wasn't fine." Lo and behold, she had a new second primary breast cancer, and it was very aggressive. She had surgery, and then she came to St. Francis for her medical oncology and radiation treatment. I'm a nurse myself, and my mom's a nurse. We thought we were fine, we don't want to bother the nurses. We know what nurses' lives are like. They're very busy. Our goal was to be low-maintenance patients.
Yeah, how long is it going to take? It's going to take 30 minutes. 30 minutes.
I mean, I've given these chemotherapy drugs myself a gazillion times, and watching them go into my mother was a terrifying experience because all of those side effects that I've taught patients about my whole life, and my mother has done the same, they were ours now, and we had to own that, and we needed a nurse ourselves.
This is one of Dr. Borokoff's patients.
Her mom actually kind of reminds me of my mom, and she's a nurse, and she's a little stubborn like we all are, and she doesn't like to complain because she's a caregiver too, and she's used to taking care of other people and not taking care of herself.
My mom was having some symptoms towards her at the end of her chemotherapy treatment, and there were things that myself being with my mom all the time, I wasn't noticing that they were worsening.
I could tell something else was going on. She seemed a little short of breath, but she denied that she was feeling poorly.
The nurse in her just knew she needed to sort of take control.
I just pursued it, and finally we got to the bottom of an issue.
Her hunch was right. There was something very wrong, and because Vidya caught it, she possibly saved my mother from a lifetime of disability. And it made a humongous difference for our family, and we will always be grateful for her.
There is medical treatment, there is all sorts of treatment for these things, but I think sometimes what a patient needs in addition to all of that is a nurse to help them.
My mother always said the nurses made me feel safe.
It's holding somebody's hand. It's looking at somebody and saying, "You're going to be okay," or "We're going to help you," and you can get through it.
It's a wonderful nursing story because we were all nurses, and it was nurses caring for nurses, and she really appreciated that. And she just said, seeing and feeling the power of nursing when she was sick, it just made her proud of the career that she had had and that she was hopeful.
I can't imagine doing anything else. I really can't. Anything else, anywhere else. I love our patients, I love our staff. It gets hectic here and crazy, but at the end of the day, they're like family. My patients and the staff here, it's family.
My mom is, she's a breast cancer survivor, and she's tough, and this was her second bout of breast cancer, and we went on a mother-daughter cancer survival trip the first time to a place she always wanted to see in Switzerland, and so now we're looking forward to planning another cancer survival trip. Mother, daughter, granddaughter.
We came here expecting a 2-day stay. He was going to have a semi-serious operation, and instead it's 7 weeks today. Ron had his initial operation, and they were checking. They thought maybe he had blood clots in the lungs or an internal bleed. And they were watching him, and he was just failing and failing and failing.
At first we thought he was going to have open heart surgery, and then the doctors all got together with the nurses, and they decided that wasn't the situation.
We were in the room with him, and his blood pressure dropped to like nothing, and they were treating him for blood clots, so they were giving him a blood thinner. And this doctor came, and he used paddles on him to because he had died, to bring him back and to bring his heartbeat back to normal. And then he jumped on the bed in ICU and just cut him open. And it turned out he had an internal bleed. And if he hadn't done that, he would have died right there.
But then all the complications came in, and he had 6 or 7 operations after that. I was there when they told Ronnie, Ronnie, you were asleep for over a month, and you're just waking up. He couldn't believe it.
Ron, he came in. He went through a lot.
First thing I remember is coming to and being in bed in the ICU.
Of course, he didn't trust us at first, and I felt that that's normal. That's completely normal. He's completely out of his environment. This is nothing that he signed up for, and it was up to us to earn his trust. You know, one step at a time.
And I was obviously emotional and scared, and they were very kind to me. And I'll always remember how helpful they were to me. It made a huge difference in my life.
For a lot of people, you realize that this is, you know, quite possibly could be the worst thing they've ever been through in their entire life.
I was standing out in the hall, and they had just finished rounds, and I was crying because, you know, it was bad. And he came over and he said, "You're drinking water, you're taking care of yourself." And I was just like, yeah, right. You know, but it was just, you know, the fact that he wasn't even Ronnie's nurse that time. He just saw me in the hall and, you know, came over and was concerned for me. That means a lot.
You know, something I think about, like, no matter how bad my day was, they have it worse. You know, they're still here, they're stuck here. And if I can use my time to make their day a little bit better, you know, that makes me happy.
He'd always come back at the end of the night, say good night, what do I need. He was always there for me, and I really appreciate it. If it wasn't for my wife, who I think is really the one that saved my life, and the doctors at Hartford Hospital, and the nurses there, I wouldn't be alive. So that's not a bad thing. I promised the nurses there that when I get better, I'm going back to say hello, and I will.
They were such an integral part of your life when you really needed them.
You're in it to make a difference, you know, in someone's life, and to help them through a tough time and make that tough time just a little bit easier, a little bit better for them.
And I know for sure the surgeons and the nurses at hospitals, Hartford Hospital, have become my friends. That's a pretty nice thing to be able to say.